Good afternoon, and welcome to an Introduction to OneCare. Today's webinar is for Massachusetts state agency staff and staff of community-based organizations. My name is Wendy Trafton, and I'm with the University of Massachusetts Medical School. I will be your facilitator. Our presenter today is Robin Callahan, Deputy Medicaid Director for Policy and Programs at MassHealth. Before we begin, I would like to discuss a few housekeeping items and learn a little bit more about you, our audience. We are using the mute feature on the conference call line during this webinar. Note that this webinar is being recorded and will be made available at a later date for individuals that are unable to attend. The audio is provided through your phone line. If you haven't done so already, please call 617-410-9095 to join in. For best results, please turn off your computer speakers. While it is unlikely, if technical difficulties occur with the audio through the telephone, you may turn up your computer speakers to hear the audio through the web if your technology allows. Also note, this webinar today includes live American Sign Language interpretation as well as live captioning. We encourage your participation and have a couple of ways for you to participate. We will have a question and answer period at the end of the webinar, and we will give you specific instructions about how to ask questions at that time. Another way for you to participate is by answering polling questions that will be asked during the presentation. A question will appear on your screen, and you can choose your answer. We will wait about 30 seconds or so for you to participate and answer the question. Poll results will be revealed instantly. Today's webinar is an overview of OneCare. After participating in the webinar, you'll be able to describe essential and unique elements of OneCare, identify characteristics of the OneCare population, explain how OneCare will be delivered and what services are available, and specify eligibility criteria and enrollment processes. Before we start the presentation, please let us know more about you, our audience, by answering the first polling question. What is your primary affiliation? Please indicate if you are participating today as a staff member of the Department of Developmental Services, Department of Mental Health, Department of Public Health, Mass Commission for the Blind, Mass Commission for the Deaf and Hard of Hearing, Mass Rehabilitation Commission, other state agency, advocacy organization, Aging Services Access Point, or Area Agency on Aging, Independent Living Center, Recovery Learning Community, or other community-based organization. I'll give you a moment to answer. Looks like we have representation from many state agencies and organizations today. Thank you everyone for joining us and participating in this webinar. I would now like to welcome Robin Callahan as our presenter. Welcome, Robin.
Thank you, Wendy. And thanks so much to all of you for spending the time to learn about OneCare. You will be very important support for members who will be making decisions about participating in the program. So OneCare is a new option that allows people between the ages of 21 and 64 at the time of enrollment who are eligible for both MassHealth and Medicare. We sometimes refer to them as dual eligibles. OneCare allows them to receive care as part of a single plan offering comprehensive benefits. It's really all about simplifying care for people who have both MassHealth and Medicare. So you might ask, why is OneCare focused on people under the age of 65? The main reason for this is that the program integrating MassHealth and Medicare already exists in MassHealth for people who are age 65 or older. It's called Senior Care Options, or SCO. OneCare will be a very similar type of program for folks who are under the age of 65 and are eligible for Medicare by virtue of having a disability. So OneCare has some similarities to SCO, but it is also uniquely designed to address the needs of adults with disabilities. A person in a OneCare plan will have the option of staying in that plan when they turn 65 if they're happy with it, but you must be between the ages of 61 and 64 to initially enroll in a OneCare plan. So what is OneCare? With MassHealth and Medicare brought together into one comprehensive set of benefits, it allows the focus to be on the enrollee's needs and on creating a plan of care for the enrollee that combines the right services together to best suit the enrollee as an individual. It will involve a person-centered care plan, and by person-centered care, we're looking for health care that is based on the goals and preferences of the individual being supported in the design and implementation of services, as opposed to goals defined by a service system or a doctor or other professional. Unless the enrollee specifically requests otherwise, in person centered systems, the enrollee decides who will be involved in meetings and decisions regarding their care. The enrollee can attend every meeting about their care. These meetings may be in person, but could be by telephone or perhaps email if that's most convenient. The personal goals and preferences of the enrollee play an integral role in the decision-making process. All options are fully explored and discussed. Information about alternatives is provided, and the choices of the enrollee are respected. So the core values: respect, self-determination, and high quality of life. These are core values that are also consistent with the independent living, self-determination, and recovery models, which are important cornerstones of OneCare. The overall goals of OneCare are to enhance the ability of MassHealth and Medicare to provide person-centered coordinated care, to improve enrollees' health and functioning in the community, and really importantly, to coordinate care across medical, behavioral health, and long-term services and supports needs, improving communication among all the providers across those types of services. And as you know, there is a real separation now in fee-for-service between the types of services provided by Medicare and MassHealth. And what we're trying to do is bring those together in a care plan. The last goal is to keep the enrollee healthy and reduce costs by focusing on community-based services that promote wellness as opposed to facility care. OneCare is a choice. It's important to know that the members that we're developing this program for do have a choice. People who are eligible to enroll can choose to do so at any time, and they can opt out at any time without penalty. So we'll talk a bit about the services that are covered under OneCare. Services are integrated to improve quality and reduce costs and include Medicare services. Those are all Part A, which are hospital services, Part D, which are doctor services and outpatient care, and Part D, prescriptions. Also covered are Medicaid state plan services, including long-term services and supports that are offered under MassHealth. Examples include personal care attendant services for people with hands-on need and people who need cueing and supervision, durable medical equipment that includes the provision and repairs, group adult foster care, home health, and other long-term services and supports. Those are just examples. OneCare also provides behavioral health diversionary services. Now these are specific mental health and substance abuse services that are community-based. And importantly, they are not offered to dually eligible members in the fee-for-service system in MassHealth. So we're able to bring these services into the OneCare covered services. So these are community-based behavioral health, that is mental health and substance abuse services, to help people avoid inpatient hospitalizations and remain in the community. They're also important to helping people stabilize if they do have an inpatient event. An enrollee's care team will work with the enrollee to decide if these services are right for them and should be included in the personal care plan. Behavioral health diversionary services include community crisis stabilization, community support programs, acute treatment and clinical support services for substance abuse, psychiatric day treatment, and emergency services programs. OneCare will also offer a set of community-based services that to some extent are or may not currently be offered in our state plan. With OneCare, enrollees can get community-based services to promote wellness, recovery, self-management of chronic conditions, and independent living. An enrollee's care team will work with the enrollee to decide if these services are right for them and should be included in their personal care plan. Community-based services include day services, home care, respite care, peer support, care transitions assistance, that's across different settings of care as a person moves from one setting to another. These also include the availability of community health workers, home modifications, medication management, non-medical transportation, that would be to perhaps community activities or employment activities. And these are things which may be included in a person's care plan if that is determined to be needed. So what is the target population? Who are we trying to serve in OneCare? This is a diverse group of about 90,000 adults in Massachusetts of different races and ethnicity, cultures, sexual orientations, religions, and abilities, including varying physical, sensory, and other disabilities. So we have adults with physical disabilities, intellectual or developmental disabilities, serious mental illness, substance use disorders. Some have multiple chronic illnesses or functional and cognitive limitations, and some are experiencing chronic homelessness. So these are all things we think about when we develop this program to serve in OneCare. So who's eligible for OneCare? As I mentioned before, these are folks that are between the ages of 21 and 64 at the time of enrollment. They must be eligible for MassHealth Standard or Common Health. They have to be enrolled in Medicare Parts A and B and be eligible for Medicare Part D. They would not have other comprehensive insurance like private health insurance. So what we're talking about are people who only have MassHealth and Medicare insurance. They would not be participating in another all-inclusive MassHealth program. such as PACE, that's the Program of All-Inclusive Care for the Elderly, SCO, or home and community-based waivers. And they would not be residing in intermediate care facilities. Those are facilities for residential facilities for folks with intellectual disabilities. So something about the characteristics of the population, so you can have an understanding of who we're actually trying to serve here. Over 2/3 of the population that's eligible to enroll in OneCare have a behavioral health diagnosis. About 50% have a chronic medical diagnosis. About 8% have an intellectual or developmental disability. Now that might seem like a small number, and that's mainly because we are not including in that number folks who are enrolled in home and community-based waivers, which constitute a large number of folks in Mass Health with intellectual disabilities. Approximately 25% are using long-term services and supports. 96% reside in the community, so 4% or so are actually residing in facilities. And over 2/3 fall into more than one of the categories I just described. Now we'll talk about how care would be delivered in OneCare. OneCare plans provide care or arrange for care to be delivered through a provider network. There would be a person-centered assessment and planning approach. It will focus on the integration of primary care, specialists, behavioral health, and long-term services and supports. They will be brought together into a personal care plan developed by a care team. The OneCare plan is responsible for the totality of covered services. So we'll talk a little bit about the assessment process. A person-centered assessment must be completed within 90 days of enrollment into a OneCare plan. During the 90 days, and until the comprehensive in-person assessment is completed, the enrollee can continue to see current providers and continue to receive the services they're getting now, or at the time they were enrolled. Of course, if the enrollee has any new or urgent needs during those initial 90 days, the OneCare plan must address them immediately. Once assessment is completed, a care planning process begins. This is when the personal care plan and care team are developed for the enrollee. So who's on this care team? The care team will include the enrollee, a primary care provider, and very importantly, a care coordinator or clinical care manager. The OneCare plans are required to provide each enrollee with a care coordinator or clinical care manager. This person will be the enrollee's single point of contact for their plan. It's the one-stop shopping for the needs of this member. Their responsibilities will include ensuring the person-centered individual assessment is held within 90 days of enrollment. They will work with the enrollee and the care team to create the personal care plan based upon assessment and individual preferences. And they will be responsible for the ongoing coordination, monitoring, and follow-up with the member and be that member's primary point of contact. Enrollees with complex medical needs would have a clinical care manager instead of a care coordinator. And that person would have some additional responsibilities. Those would include providing intensive clinical monitoring and follow-up as needed, and working with the enrollee and the care team to assess clinical risks and needs. The care team would also include behavioral health providers if indicated, and also long-term services and supports coordinator or LTS coordinator if indicated. So let's talk a little bit about this coordinator. If an enrollee has long-term services and supports needs, that is, they use DME, durable medical equipment, personal care attendants, GAFC, home health, if they're using those services or they need those services, they will have the choice of having an LTS coordinator in their care team. The LTS coordinator will be an individual from a community-based organization with expertise in the enrollee's disability and LTSS needs. This person is not a direct employee of the OneCare plan. The LTS coordinator will serve as a full member of the care team, serving at the discretion of the enrollee. The LTS coordinator will facilitate community integration and independent living, advocate for the LTSS needs of to serve the needs of the enrollee, provide education to the enrollee and to the rest of the care team about long-term services and supports, provide LTSS coordination, that is, participate in assessments, evaluate and monitor the personal care plan with regard to LTSS. The coordinator will assist the enrollee to access personal assistance services if those are needed, and assess the appropriateness for facility-based LTSS if that is ever considered. The enrollee plays the central role in choosing members of the care team, and the enrollee is the leader of the care team. So who else might be on this care team? Again, it's a personal plan, so it will vary based on the needs and preferences of the enrollee. So it could also include specialists, peers, and these are individuals that can support an enrollee's recovery and wellness objective, family or friends, or someone else that the enrollee trusts, other informal caregivers. It could include community health workers, advocates, social workers, state agency case managers, or anyone else that the enrollee feels is important to help them manage their health and independent living objectives. So we'll talk now about the personal care plan. So the enrollee, in cooperation with the care team, develops a personal care plan. Based on the information gathered through the comprehensive assessment, the enrollee will have a choice to direct the care team in every aspect of the personal care plan and has the right to be involved every step of the way. The personal care plan itself will cover the whole range of medical, functional, behavioral health, social, and support needs. If the personal care plan does not reflect their needs, the enrollee has the right to disagree and appeal if they feel necessary.
We have another question for you, our audience. Please let us know if you've ever been involved in a person-centered care team. You can let us know by selecting yes, no, or not sure. Give you all a moment to respond. Like we have about 2/3 at this point who have been involved in a person-centered care plan or a person-centered care team. Thank you.
So now we're going to talk a little bit more about the OneCare plans themselves. and we'll talk some about the enrollment process. So who are these OneCare plans? There will be 3 health plans who will provide OneCare products. The OneCare plans are Commonwealth Care Alliance, Fallon Total Care, and Network Health. Each of those health plans has a defined service area. So Commonwealth Care Alliance will be available in, and these service areas are defined primarily by counties. Commonwealth Care Alliance will be available in Essex, Franklin, Hampton, Hampshire, Middlesex, Norfolk, Suffolk, and Worcester counties, and will also be available in certain towns in Plymouth County. Fallon Total Care will be available in Hampton, Hampshire, and Worcester counties. Network Health will be available in Suffolk and Worcester counties. So now let's focus on the enrollment process a bit. Starting in September, or starting this month, we started a self-selection process. So eligible enrollees will receive a packet in the mail about OneCare. So this packet will go out to all of the close to 90,000 members who can participate in OneCare. And it gives them the opportunity to join one of the OneCare plans, and they will receive a lot of information about those plans in the packet. Or it also allows them to opt out of OneCare. And by opt out, I mean they can tell us, I don't want to change how I get my care. I do not want to be involved in OneCare. So they have both of those opportunities in this package to learn about health plans, to help them make decisions about how to choose one, and also to let us know if they do not want to be in OneCare. So the mailing will include specific information about the OneCare program. It will identify OneCare plans serving that individual's geographic area. It will include information on how to contact each plan, because that's something that someone's going to want to do if they're considering a plan. They want to talk to that plan about that plan. And it will also include information about other places the individual can go for additional information or help. We'll talk more about the mailing in the next slide. There is also a concept in the program called auto assignment. So that process has not begun yet, but it will be coming down the road. So if eligible individuals have not chosen a OneCare plan, or they have not opted out, they may be automatically assigned to a OneCare plan. If a person is being auto-assigned, he or she will get a notice in the mail at least 60 days before their auto-assignment takes effect. That person will have 60 additional days to tell MassHealth if they want to choose a different OneCare plan or opt out of OneCare. Auto assignment, when it does start, will happen in a few different waves. The first wave will have an effective date of January 1st of 2014. And it will be for individuals that have less acute needs from what we can tell in our data in the eligible population. So whenever someone is auto-assigned. Again, they will have plenty of time to let us know if they want to accept that enrollment or they want to change that plan to a different one that's available to them, or they want to opt out. So in general, all enrollments are effective at the beginning of the next month from the time the person identifies a plan. And disenrollments are effective as of the first day of the month after someone tells MassHealth they want to disenroll. So in other words, when a person is enrolled in a OneCare plan, it's a monthly enrollment. They can change at any time, but that change will be effective at the beginning of the following month. So we have started this month the mailing process. So here are some of the details so that you can help recognize if someone you're working with has received this mailing. The mailing includes a cover letter, and there is a purple stripe across the top of this letter, so it will be easy to identify and refer to. So if someone is describing a mailing they received from MassHealth and they're confused about it or want to get some help with it, one thing you could ask them is, did it have a purple stripe? Also in the mailing is something called an enrollment guide. It includes tips for choosing a OneCare plan and how to find out more about the plans. It describes the options for signing up and ways to tell MassHealth if a person does or does not want to join a OneCare plan. It contains information about how to contact each of the plans that are available to that person. It also contains contact information about MassHealth customer service. All enrollments will be transacted by MassHealth customer service. And the mailing also gives information about how to contact SHINE. That stands for Serving the Health Insurance Needs of Everyone. And I think we'll talk a little bit more about SHINE in a moment, but for those of you who don't know about SHINE, they are a network of folks who have been around for a long time, who have information and are very knowledgeable, particularly about Medicare and the choices people can make around how to get Medicare services. So they have been specially trained in OneCare and are a very good source of information so people can make sure all of their benefits are well protected as they consider their options. The mailing will also include an enrollment decision form, and that form will list the available plans for that person and include the option for an individual to not sign up or opt out of OneCare. The mailing also includes a list of covered services and a return mailing envelope. So mailings began at the beginning of this month, and over the course of this month through early October, we will stagger mailings to these approximately 90,000 people. At the beginning of September, and this has already happened, the first batch went out, and it was sent to about 27,000 individuals. And we started with these individuals because they might be subject to auto assignment at some point. And our mailings will continue weekly until the first week of October, until we get to all 90,000. The mailing envelope that folks get will be marked with the Commonwealth of Massachusetts seal and the return address and the words confidential, important, open now. You see a picture of it on the slide. So it's really important that individuals who get this mailing and are considering OneCare options get the assistance they need to make an informed choice. So as I mentioned before, one of the primary places to get this support is through Shine counselors. They are Medicare experts trained about this new option. They are funded by the Centers for Medicare and Medicaid Services and managed by the Executive Office of Elder Affairs in coordination with community organizations. And they've been around since 1993. Shine is one of 54 state health insurance counseling and assistance programs nationwide. They provide free and objective health insurance information and counseling for beneficiaries with Medicare and for those who are dually eligible. The counseling they provide can be face-to-face, can be held in accessible locations, by phone or by email. Topics that they are knowledgeable about include Medicare and Medicaid eligibility, prescription drug lists and pharmacy of choice, provider lists, OneCare services versus current services, information about the ability to opt out of OneCare or choose a OneCare plan, and generally other options that are available through the Medicare program. The other important point of contact in this decision-making process is MassHealth customer service. They can answer OneCare questions, provide details on OneCare plans, and most importantly, they facilitate actual enrollment and provide general direction to eligible individuals. All enrollments in OneCare will be made through MassHealth customer service. The other thing that we urge is for members to consult trusted state agency and community resources, which is one reason we're having this webinar. It's very important that folks that our members go to and trust are knowledgeable as well and can support them in their choices. A very important consideration for enrollment for eligible enrollees is whether their preferred clinicians and providers are part of the OneCare Plans network. Individuals can ask and should encourage their providers and clinicians to join OneCare if they're interested in being in a OneCare plan. But at the very least, they always should know if their important providers are part of their plan. So next you'll see an enrollment timeline. So again, we said this month we've started with the mailing of enrollment guides and self-selection letters to individuals. We are engaged in many different types of outreach outreach activities to eligible enrollees. Also this month, the OneCare plans, the actual health plans, have begun their direct marketing. So they are able, within certain parameters, to market on their own to describe what their plans can offer. So October 1st is the very first enrollment date, enrollment effective date. So people are getting their letters in September and are choosing plans, and somehow have already started choosing plan, are signing up for an enrollment effective date of October 1. In November, by November 1, we will be contacting the first group of people we will approach around auto assignment. Now we will only auto assign people if they are in an area that has at least 2 OneCare plans available. So we'll talk more about that in a while, but there will be a certain group of people who will start to see some notices by November 1st around auto assignment. January 1st of 2014 is the first effective date of enrollment based on auto assignment. We plan on having subsequent auto assignment waves, perhaps in April and July. A lot will depend on what the enrollment dynamics look like as we go along. So, in conclusion, OneCare provides opportunities to improve care for people with disabilities and help contain the growth in costs by putting persons with disabilities at a central decision-making role, by reducing divisions of care, especially for those with multiple and/or complex needs across medical, behavioral health, and long-term services and supports areas, by enhancing focus on person-centered outcomes as opposed to numbers of services, by realigning incentives to reduce cost shifting, and that is cost shifting between the Medicare and Medicaid programs and between different types of providers, and lessen the reliance on acute care by promoting community-based care. We believe that this model has the potential to reduce costs because we'll be providing the right care in the right place, which is the community. We'll also be serving the enrollee in the context of their own culture and community.
Thank you, questions from you, our audience, including questions that were submitted during pre-registration. You can ask a question by typing it directly into the text box on the left-hand side of your screen. The pop-up text box is labeled Q&A. We will answer as many questions as possible. You can also find additional information on the OneCare website, which is located at www.mass.gov/masshealth/OneCare. First question we received is, can people start enrolling in OneCare now?
Yes, enrollment opened up this month, and again, we're reaching out to people to let them know about their options, both by the direct mailing and some public awareness campaign activities that we're involved in. So the OneCare program is officially open for enrollment.
Great. How does OneCare impact PCA services?
So I think the first thing that's important to be said is that a person who enrolls in a OneCare plan, if they already have a PCA through our state plan, and our state plan has self-directed PCA, they will be able to keep their current MassHealth PCA if they're happy with the services they're getting and the person who's providing their care. The OneCare plan must pay the fiscal intermediary that's currently in place so that their current PCA can continue to receive reimbursement in a way that's not interrupted. So self-direction also is required to be offered in any time that a person is identified as needing personal services. So we plan to maintain and keep intact our self-directed PCA program. However, OneCare will also must be able to offer personal care services from an agency if there is an enrollee who chooses not to self-direct or does not want to have employer responsibilities. The OneCare plan and the care team will be making decisions about um, or confirming decisions about the hours of personal care services. However, it is important to know that a person who has a PCA at the time of enrollment that they chose and want to keep must be allowed to do so.
Thank you. If I'm helping someone decide if one care is good for them, what things should we be thinking about together?
Well, I think that a primary thing that a person should think about is whether or not the, the providers that they are most reliant on or most interested in keeping will be available to them through the one care plan they select. And that can happen in two ways. Either the one care plan already has that provider in their network, or the provider and the one care plan come together to have that provider join the network. So I think the first thing is to make sure that people are able to have the immediate needs and providers that they want to have, that they're able to access them through their one care plan. The other thing they should think about is, are they currently having some difficulty in organizing their health care, or feeling that they understand what their health care options are? If they are in that situation, and really sort of by our focus groups that we held much earlier in the process, we found out that many dually eligible people are in that situation, then they're a really good candidate for this program, because they will have a single point of contact and they will have a care team that is readily identified to them to help them organize their care needs. I think the other thing that's important is to remember that the one care plan will also be that person's Part D prescription plan. So people need to be really careful to make sure that the medications that they rely on and the places that they use to get their prescriptions are available through their one care plan, or are conveniently available through some other option that the one care plan offers. So I think those are the major things that people really need to focus on.
That's very helpful. Um, are nursing homes included in this plan as well?
Yes, all Medicaid state plan services are included in this plan. So folks who are in nursing facilities who are dually eligible and meet the other eligibility requirements of one care can enroll. And the plans do have contracts with the nursing homes. They will become the payer to the nursing homes. They will provide the same type of um, involvement and care planning for folks that are in nursing homes as those in the community. And actually, we're hoping that their involvement will actually help in the cases where there are opportunities for folks to return to the community, or to make sure that the services that they're receiving while they're in the facility are the highest quality.
I have another service-related question. Um, Block nursing services are available to our patients who are ventilator dependent through Mass Health. Will these also be available under One Care?
Absolutely.
Thank you. Well, are there any premiums for One Care?
That's a really important question. Because I think there has been some confusion about this. The one care plans themselves, the health plans, cannot collect premiums from members. However, as you know, some of our members that are duals are in common health. That's a Mass Health eligibility category. And common health members, some of them have to pay premiums to Mass Health in order to be Mass Health eligible. Enrollment in one care does not have any effect on the obligation to pay common health premiums. And again, those premiums are not paid to the health plan, but they are a requirement of mass health eligibility. So I do think and hope that I'm making clear the distinction there. If there is a person who's currently paying a common health premium, they will continue to have to pay that in order to be mass health eligible. But under no circumstances does a one care enrollee pay a premium to the health plan.
What appeals related to One Care go through Mass Health?
The enrollee will have appeal rights of both the Medicaid and Medicare programs. And there will be a specific webinar coming up around enrollee rights that you will probably want to take part in if this is a particular interest. But generally speaking, there are certain services that are going to be in this in this program. Again, we're joining together Medicare and Medicaid services. So to the extent that a service has traditionally been a fee-for-service Medicare service, people will always have the option of appealing through the Medicare process. Folks also have the option, if those services are reduced or denied, for example. A person also has the option of appealing to our Mass Health Board of Hearings for those. So they have sort of double appeal rights in a sense. And there is a lot of effort to make those appeal rights clear to them in the documentation that the plans have to provide to members as they approve or deny specific services. For the services that are pretty much exclusively Medicaid services, and by those I mean things like long-term services and supports that Medicare simply never has paid for and doesn't in the absence of a joint plan like this. Those services would need to be appealed directly to the Board of Hearings. So I know that this might sound somewhat complicated. Again, we are going to have a specific webinar about it, but I think the rule of thumb you should use is that people in One Care have the full protection and appeal rights of both the Medicare and Medicaid programs.
Another question. What happens to eligible members who do nothing in response to the mailing?
So this is where the possibility of auto enrollment comes up. If someone does nothing, then we will look to see if they should be included or will be included in our auto assignment process. Now, we will only auto assign in the areas that have at least 2 plans available. So if a person lives in an area where there's only 1 plan available or there's no plan available, they would never be auto assigned. If a person lives in an area that there are at least 2 plans, and those would be Hampden County, Hampshire, Suffolk, and Worcester counties, then they potentially could be auto assigned. If they are auto assigned, the process I spoke about before, where they would get a specific advance notice 60 days in advance to let them know, and then they would still have the opportunity to opt out or to let us know they prefer a different plan. Again, if they take no action, they will be enrolled in the plan that was chosen for them.
Thank you. Another question that came in is, how do providers find out which of their Mass Health participants are eligible for One Care?
Well, I think the primary thing to think about is the general eligibility for One Care. There isn't necessarily somewhere they can go to say, here are all the people that you see who are eligible for the One Care plan. there are certain characteristics of folks that determine whether they're eligible or not. First of all, are they do they have Mass Health Standard or Common Health? The next question, do they have Medicare Parts A and B? Those are fairly readily, that's information that's fairly readily available to a provider. Some of the other characteristics, not every provider would know, but they can ask. If the person is participating in SCO or PACE, they're not going to be eligible. If they're in a home and community-based waiver, they're not eligible. But I think the major thing that providers should look for is whether or not that person is a dually eligible person. And if so, understand that they could be eligible to participate in OneCare, and there would need to be more personal information in order to tell that. Now, on the other hand, if the question is more about how will a provider know if a person is enrolled in OneCare, that's a much easier question. When the provider, all of Mass Health providers use an eligibility verification system called EVS. And when they access that system, which they would do in the normal course of business, they would be able to see by a message that that person is enrolled in a OneCare plan, and they would be informed which OneCare plan and the contact information for that OneCare plan. So that will be an ordinary way for providers to understand who is enrolled and who's not.
Thank you. Will DDS consumers who are on the waiver qualify for OneCare and receive an enrollment notice?
No, at this point, the way the program is set up, we are not enrolling in OneCare people who are enrolled in home and community-based waivers. So right now, a person cannot be in both. Before we did the mailing, we identified who is in a home and community-based waiver, and we did not send a mailing to those people. We did not want to create the confusion um, or lead them to believe that they could enroll when they really couldn't. So they are not included in the 90,000 folks that we have mailed to. If a person tried to enroll in OneCare and our system showed them to be enrolled in a home and community-based waiver, we would send them back a letter saying we weren't able to enroll you in OneCare because you are enrolled in a home and community-based waiver.
Okay. How will the OneCare care coordinators interact with state agency caseworkers or service coordinators?
So we believe that for people who have state agency service coordinators, that information should be discovered through the assessment process. In talking to the member or people involved in the member's life, we believe that that will be identified. There are also certain information that we can share with the plans about our information as to the extent that we have it, as to whether or not there's an association in our MMIS system between this person and DDS and DMH. However, I think the more important place to get that information is from the member themselves during the assessment process and finding out what type of supports or what type of programs they're involved in. And the care coordinator, the OneCare coordinator, if they have the enrollee's permission, could and should reach out to that state agency coordinator to identify that they are working with the member and to share information with the member's permission that can help inform the care plan and to make sure that there is coordination between the objectives of the state agency's efforts and the objective of the OneCare plan.
Great. I have another service-related question. You spoke previously about group adult foster care. Is adult foster care also an available service?
Absolutely. And the list that I gave was really an examples list. It wasn't comprehensive. I urge you to look at on our website. We have a One Care booklet that has a complete list of covered services. You will want to see that. We sent that list to all of the and included in the mailing that we made to the 90,000 folks so that they would know it. But every state plan service provided through the Medicaid program is included in the One Care program, including adult foster care.
Great. Do the One Care plans have lists of providers available so that individuals can look up the names of their providers and see if they're within those networks?
Absolutely. The One Care plans have websites that contain their provider lists. Or you can call the plans, or you can call customer service, or you can call Shine. All of those places will be able to access the provider list of each health plan. On we have a One Care website also that you can go to that will take you to each One Care health plan and can get you to their website so that you can access their provider list.
Thank you. How will it be determined which One Care provider will be assigned through auto enrollment?
Um, if I'm understanding, how will we decide which plan to enroll the person in, I think is the question. Well, one of the things that we're working very closely with the plans on, and again, our first round of auto assignments will be for folks with the lower end of acuity in the target population. So these are folks that we look through our claims history and our diagnosis history and discovered that these are folks, relatively speaking, that don't have an enormous amount of long-term services support spending or behavioral health spending. So those are the group we're going to start with because we think that that is the best place to start as we get our legs under us on this program in this process. We have received from the health plan a list of their major primary care providers and in their networks. And for this first round, we will try very hard to identify which potential enrollees are associated with those primary care practices. And we will try very hard to make sure that the folks that we auto assign are auto assigned in health plans that have their primary care provider in the network.
Will eligibility for state plan services like Mass Health Services like DME and AFC continue to be approved through the current prior authorization process?
Very good question. No. The answer to that is no. As you know, we have many, many different processes attached with many different types of services. Interestingly enough, they're not necessarily tied together in terms of how services are approved. So that is one of the things we hope to see in One Care. And this is one reason we believe that One Care makes a lot of sense for people using a variety of different types of services that are currently approved in silos. The One Care plan, their health plan, and the care team is responsible for the approval process for all services in the care plan. So there'll be one point of contact around getting approval for any number of service needs that person has.
Another question that came in is, does the care plan coordinate the Part D coverage, or does the client need to continue to find their own Part D plan?
Now, the One Care health plan, once the member chooses that health plan becomes their Part D plan as well. So they would no longer have a separate Part D plan. Again, all of the Medicare and Medicaid services are brought into this one plan of care.
Um, can people have community supports while they're also in the nursing home?
Absolutely. And, I think that one care provides many flexibilities that we don't see in the fee-for-service system, where we will only pay for one thing or the other. I think a very important thing about one care is that if a person is living in a facility, the one care program still has the responsibility for doing a full assessment of that person and understanding what their needs are, not just in the facility, but in the community. And hopefully, to some extent, will help to allow a plan that will help people return to the community if that's their desire, or if that is feasible. But even aside from that, the One Care plan can provide services for people in facilities that are not restricted by the fact that the person lives in a facility.
Will one care be made available to the remainder of the state at a future date?
Well, I think, One Care is being introduced today as a demonstration project. It's the federal government has, through CMS, has allowed states this opportunity to try some new things with regard to providing integrated care to dually eligible folks, and this is our try. Um, we hope that, and we will monitor very carefully to see if it is successful, if it is making sense to people, if it is accomplishing the goals that we talked about of the program. And we hope that to the extent that it is a care option that uh, is adding value, and we strongly believe it will, that over time we'll be able to expand it throughout the state.
Will there be changes in the billing process for providers?
There will, in this sense. If a provider currently has been seeing a person on a fee-for-service basis, then what they're doing now is, depending on what service they're providing, they're looking into the system. They're finding out if what the person's eligible for, and in this case, they will be finding out the person is eligible for Mass Health and also eligible for Medicare. They're making decisions about who is the first payer for a given service. Oh, it's just because Medicaid is a payer of last resort, so they're sending in bills to Medicare, and in certain cases they're waiting for those bills to get rejected, and then they get sent to Medicaid, and there's a whole dance that goes on around billing for people who are dually eligible today. That disappears in One Care. The provider will be paid by the One Care plan. So when they're providing services, they're going to see in this system that this person is enrolled in One Care, and they will have a relationship with that. If they're in that One Care network, which we're hoping many, many providers are part of, that they will have a relationship with that plan around how to do billing, and how to do prior authorization, and all of that will come through the health plan. So they will receive payment for any enrollee. They must receive payment through the health plan. Once a person is enrolled in One Care, Mass Health will not make fee-for-service payments for that person, and Medicare will not make fee-for-service payments, with very few exceptions, hospice being one of those exceptions. Medicare will continue to pay fee-for-service hospice for Medicare enrollees. But other than that, generally speaking, providers need to know that they cannot continue billing in the same way when a person is enrolled in One Care.
Thank you. Some of what One Care offers in the community seems to duplicate what state agencies are already offering. How do they integrate these services?
Well, I think we're hoping to achieve integration really through care coordination, and in this case, there would be coordination on both sides. And I think the major thing that would need to happen is for there to be discussions between them and to really understand um, how to best coordinate this to keep it as streamlined for the member and to really be respectful of the best way for that member to get those services. So it's really going to be determined on a case by case basis, but the first thing we're trying to achieve in One Care is to communicate. We see people, these are folks with highly complex needs, some of them. I should also mention that there are also folks that are the highest cost folks in both the Medicare and Medicaid programs. And those programs are now functioning completely in isolation of one another. And you add on that the isolation from the activities of the state agencies. So what this means to do is to bring those things together and to have one consolidate. We're talking about one person. And this is not a person that's spread around in different programs. They have one set of needs. And we expect that the care coordination from the One Care plans reaches out, and we hope that the agencies will reach back to have a plan of care that makes sense for that member.
Thank you. Medicare currently has copay requirements, and these follow income and other status. Are there still copays in this new program?
No. All of the plans have agreed, and I'm talking now about pharmacy copays. All of the plans have agreed to zero pharmacy copays. So they're really that should clean things up a lot. I know, folks, many of these folks are low income subsidy folks and other sort of complicated things go on. But for pharmacy, all plans have zero copays.
I'm wondering if the care coordinator is going to act as an advocate for the member if they're trying to look for accommodations like ASL interpreters or other accommodations when they're going to see providers.
That's an excellent question. Absolutely, that is a role of the care coordinator. One of the things um, that is key to this program is we know based on the very definition of the target population that everyone in this program has some type of disability, and they cover a whole range of areas. Having a focused program allows us to focus much more attention and be much more vigilant about making sure that people with disabilities who are accessing the healthcare system and accessing this healthcare system particularly um, um, have accommodations to what their needs are to get quality care. And that is another area that we will spend time with in the webinars. I think there's a webinar coming up on ADA compliance and other things. But it is very important to us that, to the extent that, and from what we've heard, many of the folks that we're talking about here have had difficulties in that area, accessing quality health care and getting good, interpreter services or equipment that meets their needs, and offices that have examination tables and other things that are adequate to give them good care. That has been a problem, and we will focus intently on that in this program.
Thank you. Are people who currently reside in group homes eligible for One Care?
Well, I guess I will put it this way. Um, many folks who are residing in group homes are doing so through a home and community-based waiver. Because currently the only way that Medicaid or Mass Health pays for group homes is through home and community-based waivers. So the kind of indirect answer is that if the person is in, we're going to go back to the basic rule. If a person is enrolled in a home and community-based waiver, they are not eligible to enroll in OneCare.
Thank you. Another question about guardians. How does an individual's guardian fit into this?
Well, we see in Mass Health different types of guardian relationships. If in the case that there is a guardian by law, and this is a person who has been determined through the courts um, um, to act on behalf of the member, then we will be communicating directly with that person as well as the member. So when we did the mailing, for example, we used the guardianship information that we had on record to also mail to the guardian. Now, there are different types of relationships where, in some cases, a person can choose, they don't have a court-appointed guardian, but they can choose to have someone to help them or to act on their behalf. Again, in those cases, if we have the applicable privacy documentation, we will share information with that person in their role in helping to support the choices of our member.
Thank you. Are there rates of reimbursement set for LTS coordinators?
LTS coordinators are contracted directly with the health plans. So the health plans negotiate with LTS coordinators on the rates of reimbursement.
Great. When will, this is a question from a DayHab provider, when will we as providers be contacted by the OneCare plans in our county, or is that something we should be doing independently?
Well, I hope that DayHab providers and other providers will be interested in joining these OneCare networks, because to the extent you have that you are serving people who could benefit by OneCare, they would certainly want you to participate in, and we want you to participate. My recommendation is that, I know that health plans have reached out to provider groups to create their networks, and in order for them to start marketing this September, they had to prove to both CMS and Mass Health that they had adequate networks in order to serve the population. That doesn't mean they have ideal networks yet. And I think all of them would want those networks to grow and to be able to establish good relationships with folks who provide critical services to the folks they're trying to draw into their plans, frankly. So I know that there has been some reaching out, but in the event that you are someone who has an established contact with a OneCare plan, I would strongly urge you to contact the OneCare plans to talk about if you're interested in joining, to get more information about what it would mean to be in their network, and to make arrangements in that direction if that's something that you would want to do.
Thank you. You spoke earlier about the assessment period when a person's getting assessed by their OneCare plan. Who's providing enrollees with services during this time?
During that time, the enrollee is entitled to continue to receive whatever fee-for-service services they were getting at the time. In other words, if you have someone and they were in a course of treatment about something and they get enrolled in OneCare, for the period of time it takes to get the assessment done, the OneCare plan has to continue paying that provider at the fee-for-service rate until this 90 days are over, or the plan of care is completed. So the plans will be required to pay for out-of-network provision of services during the period of this during the assessment period.
If some individuals haven't received the mailing yet, or some just won't because they don't have an address, such as the homeless population, when and how can these individuals enroll?
Right. So I think that it's really because we know that there are situations like that that we don't want to rely only on direct mailing. We are doing as much advertising as we can. We're developing. We have a website that folks can go to get information, and all they really need to do is call customer service. They can call Mass Health customer service. They can confirm whether or not they're eligible to enroll, find out information about the programs, and enroll directly from if they're eligible to enroll. They can also contact Shine, and Shine can also help them to enroll if they're eligible to enroll. For many of those folks, if they didn't hear from us directly, their first question would be, "Can I enroll?" And that's a question that really can be answered through customer service very, very readily.
And in that last question, we talked a little bit about the homeless population. Will there be someone available on the care team to help members who are experiencing homelessness?
Absolutely. I mean that I one of the things that we really have spent time with the plans around and will continue to is to really talk about what kind of strategies can be used to reach out to homeless populations. And many of them have and will continue to develop relationships with other community entities that are good connection points for people who are experiencing homelessness, whether it be shelter providers or healthcare for the homeless or other programs. Also, many of the health plans are developing sort of teams of community health workers who can also do some more direct street level work around trying to identify folks who might be eligible and engage them in the process. So that is going to be difficult, and it's difficult in any event. But I think the difference is, to the extent that someone who's experiencing chronic homelessness can be identified to a health plan, that at least there's someone out there reaching out to them. And providing options for them to be engaged and brought into the healthcare system if to the extent that it's needed and wanted by the person. So we don't have a perfect answer for that, but I think that knowing that that is an important part of this population group, that allows us to work with community-based organizations who have contact points to really leverage access to that population and for that population to access services.
Great. Do you anticipate that in the future there'll be more than 3 choices of one care plans for members?
Well, I think that's a distinct possibility. I think right now we are where we are, and I think that success will breed success, and we're hoping to get off to a good start. And we'll see. I don't know, but right now I think our focus really has to be on where we are and maximizing the opportunities that we have with these 3 plans.
Thank you. I have a question from a person who provides services now, and she's saying that her clients typically have trouble with change, especially with new providers. That this can often be particularly stressful. Um, do you think that there's any advantages to choosing one care, or could this be a disadvantage for people who might have trouble with change?
Yeah, I mean, I think that's why, all things have to be considered here. First is that people should not feel they're sort of out on their own trying to manage whether or not um, to make this decision. I mean, that we're having these webinars and we're trying to reach out as much as possible to give people the tools that they need to help people make this decision. And it is a personal decision. One care isn't for everybody. or isn't going to be wanted by everyone. But I think there's a couple of things we can think about when we talk about change in providers. First, to what extent we can get providers to participate. That's a major thing. We want providers, important providers, to participate in this program, so that members can get not only the advantages that you bring them, but that you can bring them in the context of a larger team, a larger care team, to offer more options for this person. And so I really urge providers to, to the extent they're thinking about people they're working with, and whether that person would be upset not to have them in their lives, of course. So please, try to participate if it's at all possible for you. I think the other thing is that we expect that the One Care plans, through the assessment, will be determining with the person who, exactly who are the most important for that people for that person to maintain contact with, and talking to that person about whether that, those folks are in their network, or whether it's necessary to make an out of network arrangement, or looking at what the options really are for that person. In the long run, if there's a person and they have a very important provider, or many providers who are not in any of the One Care plans, and those providers do not join, or the person does not feel they can deal with the transition, it might be a viable decision for that person to choose not to be in One Care. So again, this is all about having a new choice for people, and presenting to people a new choice that we think adds value, and and giving people enough information to make an informed decision about whether it's right for them.
Thank you. Had a number of other questions asking where individuals can obtain this webinar and other information about One Care. So I'm just going to actually point out that on the screen you'll see our URL, www.mass.gov/masshealth/OneCare. At the site you'll be able to find the webinar and other information about One Care. And I see we're almost out of time, so I really want to thank Robin Callahan today, and thank you to our audience for attending.